Good afternoon. Today is April 9th, 2020, and our community update on COVID-19 in Buncombe County is underway. My name is Stacy Wood. I serve as a Public Information Officer in the Emergency Operations Center. Our goal in providing these live updates is to ensure that everyone in our community has access to the same information. The Spanish language version of this community update is being aired currently on the Buncombe County Health and Human Services Facebook page, and that Facebook handle is @BCHHS. Today's community updates are from the following speakers: Dr. Jennifer Mullendor, Buncombe County Interim Public Health Director and Medical Director; Fletcher Tove, Buncombe County Public Health Preparedness Director; Kit Kramer, President of the Asheville Area Chamber of Commerce and Chair of the One Buncombe Fund; and Esther Mannheimer, Mayor of Asheville, who will be providing updates on the shelter at Harris Cherokee Center. We will begin today's community update with Dr. Mullendor.
Good afternoon. As of 2 p.m. today, there remains a total of 37 lab-confirmed cases of COVID-19 in Buncombe County residents, the same number that we reported yesterday. 33 of these individuals have recovered from their illness and been released from isolation. There remains one death associated with COVID-19 in a Buncombe County resident. As I stated earlier this week, we know that this number of 37 cases is an underestimate of the true number of cases of COVID-19 in our community. This results from a lack of availability of test supplies that has only recently started to resolve, and from guidance from federal and state public health agencies that limits who should be tested. While various lab companies continue to get FDA authorization to sell their products, there are still limits on testing supplies. Many local healthcare providers continue to offer testing in their practices. The turnaround time for these tests has improved, so that results tend to return within 72 hours. And some rapid testing is available in limited quantity in our area, with results returning within 2 hours. However, the current guidance from the state remains that people with mild symptoms of COVID-19 do not need to be tested unless they live or work in a high-risk setting, like a nursing home or a doctor's office, or as a first responder. Most people with COVID-19 develop a mild illness and can recover safely at home. Testing by Buncombe County Health and Human Services staff remains focused on individuals with symptoms who live or work in high-risk settings, as we know that one case in a nursing home or a homeless shelter can spread quickly through a very vulnerable population. Across the state and in our region, we see a growing number of outbreaks of COVID-19 in several of these types of facilities. Fortunately, at this time, there are no cases of COVID-19 in any nursing home or congregate living facility in Buncombe County. We have conducted testing and worked with facilities in our area to ship tests to the state lab. So far, all the results that have returned have been negative, and we are waiting on the results of 3 tests collected in the past couple of days at various facilities. Our community's efforts at physical distancing is making a difference and will continue to show itself in the impact of this disease in our facilities and at our hospital. Please do not stop taking this guidance seriously. Now is the time for us to be reminded that we all must care for everyone else in our community. We know it is hard to maintain these restrictions on your activities, but it is critical to our ability to better protect our health, the health of the vulnerable in our communities, and our health systems. Extended family gatherings, birthday celebrations, funerals, weddings, and other religious events have been altered or canceled for now, because that is an important step in protecting our community. We have seen in other areas of the country, before physical distancing measures were put into place, that these kinds of events help to spread the virus beyond household contacts and into the broader community. Let's take care of each other in Buncombe County by staying physically apart. The calm and quiet in our streets is the sound of an incredible local and statewide effort to keep our physical distance. We are each playing a role in something bigger than ourselves. We are slowing the spread of the virus. We are saving lives. I know that you have heard this before, but it is so important that I will say it again today. Keep washing your hands. Keep staying away from others who you don't live with. Use a cloth face covering when you must go out into public settings like the grocery store. If you are sick, stay home and follow the guidance of the CDC on when it's safe to interact with others again. Older individuals and individuals of any age who have severe chronic conditions like diabetes, serious heart disease, moderate or severe asthma, or immunocompromising conditions should take special precautions because they are at higher risk of developing severe illness from COVID-19. It's important that all of us take care of ourselves during this global pandemic. The physical distancing, the 24-hour news cycle, the change to our daily habits can lead us to feel anxious about things we can't control. When we take breaks from the news and turn toward things we enjoy, we give our stress response a needed rest. Please try to relax, try to rest and get some sleep. Drink plenty of water. And this weekend, do something that you enjoy, but in a safe way that doesn't put you or others at risk from COVID-19. Thank you.
Good afternoon. I'm Fletch Tove, Buncombe County Public Health Emergency Preparedness Director. I'm going to spend my time today answering some common questions about the new stay home, stay safe order that went into effect this morning. First question is that people were asking about a specified end date for the current order. So we have not specified an end date for this newest order, and the exact verbiage is until repealed, replaced, or rescinded. But this will end. We'll get through this together and get to a point where we can start relaxing our restrictions and opening up our communities again. But we don't know when that will be right now. We can look at data and we can look at models and come up with general dates. But the truth is, no one knows the specifics. So we have to make assessments every day. We know that the biggest strain on our healthcare resources hasn't happened yet. And we don't know how severe that will be, but we know it's likely to happen sometime in the next 2 to 6 weeks. We know that even after that initial peak, if we relax our mitigation measures too soon, we'll just end up with a second double peak. And we know that even after that initial peak phase, at some point, we're going to see a second wave and likely a third. So we are choosing to keep this end date open so that we can make it a continual assessment and determine the best time to start relaxing these restrictions. We're also preparing for the probability of Governor Cooper extending his stay-at-home order well into May. And this will allow us to better align with that possible extension. But I do want to assure everyone that Buncombe County government is continuing to make decisions that are in the best interest of the public health of the residents of Buncombe County. We also look forward to being able to relax our restrictions, but we're not going to do that until it's the right time. Our next question. Some greenways and parks have been closed, but you're also encouraging outdoor exercise. Can you explain that discrepancy? So outdoor activity is considered essential and is encouraged both for exercise and for mental health purposes. But you still must abide by physical distancing and mass gathering orders. That means no group activities, no carpooling with people outside your immediate household, and keeping 6 feet distance from others. You also must observe and adhere to any and all park closures. Some parks across the city and county are closed due to specific health and safety concerns. Some are open. Go to the open ones, enjoy the spring, but keep your distance and protect everyone. Another question about our drive-in worship services. So religious groups may now conduct drive-in or parking lot services. This was a previous restriction that was relaxed as of this morning when the new order went into effect. However, the leaders of these services are responsible for ensuring that their congregations stay inside of their vehicles for the duration of their time spent on the premises and observe the following guidance. Only individuals from a single household should be in each vehicle. This means no carpooling, no use of church buses, no having the neighbor's kids jump in the back of the car with your kids, or no sharing a car with your uncle or friend. Vehicles should be parked 6 feet or more from each other. Do not pass anything between vehicles, such as offering plates, money, hymnals, and paper. No communion. And no physical contact, such as during passing the peace or including handshakes, hugs, and kissing. Next question. What about people who have second homes, summer homes, or vacation lodging of some sort in Buncombe County? All visitors traveling to Buncombe County from outside the state of North Carolina upon arrival must quarantine for 14 days at their place of residence before entering the community. This means that you come into Buncombe County and you go straight to your residence. You don't go to the grocery store, you don't go to essential retail. So you need to have the support in place before you arrive to facilitate this quarantine. You need to have a plan for how you will get food and essentials without entering the community. This mandate has been posted at the Asheville Regional Airport and is being announced as flights come in. It has also been passed to our local hotels and homestay networks via Explore Asheville. And for one point of clarification, this mandate for visitors does not apply to travelers coming into the county on essential business. Which leads me to our last question for today. Our new order limits hotels, motels, beds and breakfasts, short-term rentals to only make reservations for essential travelers only. It states that lodging operators must document the essential business occupation or essential function of any visitors making reservations from outside the county. How should they document that? We've been working very closely with Explore Asheville to develop a standardized form for documentation for the essential reasons for travel for these visitors. That form will be available at the end of the day on AshevilleCVB.com. That's AshevilleCVB.com. And you could go there and follow the links to the COVID-19 resource page. Thank you.
Good afternoon. My name is Kit Kramer, and I'm president of the Asheville Area Chamber of Commerce, and I also serve as chair of the One Buncombe Fund. As you'll recall, the One Buncombe Fund was created to minimize red tape and move as quickly as possible to provide assistance to our community in two ways. First, to provide financial support to those who have lost their jobs due to COVID-19 while they're awaiting support from state and federal resources. And second, to provide loans for local small business owners who are trying to keep their businesses afloat. As of this morning, the onebuncombe.org website, which is now tracking online donations in real time, shows that we have had over 399 citizen and organization donations. Our total donations as of this morning are $941,763, roughly $60,000 short of our $1 million goal by the end of this month. As of today, Buncombe County Health and Human Services, which administers the individual grant process, has received 2,050 applications for individual assistance. Of those, 775 requests have been processed for $138,000 in approved expenditures to 341 people. Of those who have received grants, 70% of those said their need was to pay for housing, either rent or mortgage. 20% said they needed to pay utility bills, and 6% said the funds would be used for car payments or insurance. People who have received the grants live across Buncombe County, with the highest percentages being in the following zip codes. 28806, which is west of Asheville, is 22%. 28804, north of Asheville in the Woodfin area, is 14.5%. 28803, south of Asheville, is 12%. And 28704, further south of Asheville, is 10%. With the remaining 9 zip codes, each accounting for less than 10% of the recipients. Mountain BizWorks, which administers the small business loan portion of the fund, has received 133 applications so far and has made 26 loans for a total of $243,000. These loans are helping retain a total of 240 jobs. Amongst the applicants were 19 minority and women-owned businesses. The most loans were made to the smallest businesses, 11 to companies with 1 to 5 employees. 6 to the loan recipients have 6 to 10 employees. 7 had 11 to 20 employees. And 2 had 21 to 30 employees. So enough about those numbers. Our community is struggling right now. Thousands have lost their jobs through no fault of their own. Small businesses that make this area so very special are at extreme risk of not being able to restart. We can help our neighbors. So thanks to those of you who have already donated at onebuncombe.org. For those of you who have not, I'd ask you, if you're able, to please do so, onebuncombe.org, and donate today. Any amount helps, and sharing the information about the fund with friends and neighbors is also very helpful to us. The need is now, so please act now, onebuncombe.org. Thank you.
Hello, my name is Esther Mannheimer. I'm the mayor of the city of Asheville. The COVID-19 global pandemic has far-reaching impacts in all parts of our community. There are so many unknowns, and we are working to find solutions to the challenges we are faced with. While there are life-saving reasons we must limit our physical contact with each other, I continue to be amazed at the resourcefulness, professionalism, and compassion demonstrated by so many community partners. What is separating us is also bringing us together in unprecedented ways. Today, I am sharing an important example of how we have come together to serve our community. In a coordinated effort, the City of Asheville, Buncombe County, Homeward Bound, and numerous community partners organized a resource for individuals without homes at Harrah's Cherokee Center, Asheville. The coronavirus outbreak represents a significant health risk for people experiencing homelessness. People living unsheltered or more likely than many to have chronic health conditions, one of the most significant risk factors with coronavirus. In response to the current public health emergency, providing safe options for those in need of housing is a top priority. The shelter will not operate as an open shelter, but will house the most vulnerable population, including those previously identified as highly at risk. The shelter operations will follow all CDC recommendations for homeless shelters and has been approved by health inspectors and the fire marshal for this temporary use. Run by the Homeward Bound staff, the emergency homeless shelter began the intake process on April 8th, yesterday. Applicants were screened by volunteer health professionals before being admitted. The center allows for staff to be able to provide food, shelter, medical services, and other basic needs for individuals. Use of on-site showers is available, mattresses and bedding are provided, as well as laundry services, Wi-Fi, and television. The creation of a temporary homeless shelter during this emergency took an unprecedented amount of teamwork and collaboration with many people and organizations across the community. Along with staff from the City of Asheville and Buncombe County, community partners include the following: Homeward Bound, Asheville Poverty Initiative, 12 Baskets, Haywood Street Congregation, UNC Asheville, Beloved, and Appalachian Mountain Community Health Center, Dale Fell VA Medical Center. This is how Buncombe County comes together while we need to stay physically apart. If you'd like to donate to the shelter, contact Ashley at homewardboundwnc.org. That's Ashley at homewardboundwnc.org, or call 828-777-1886. Donations can also be dropped off at 205 Elk Park Drive in Woodfin. The drop-off process allows for donations to be safely collected and sanitized before being distributed. Thank you.
So today, we are asking individuals and organizations across all sectors to roll up their sleeves, pull together, and help our community during this time. Buncombe County United Way of Asheville and Buncombe County and the Asheville Chamber of Commerce have partnered to meet the needs of our community through InKind donations. In addition to the need for protective masks of all kinds, agencies are reporting a need for laundry detergent, cleaning supplies, bleach wipes, canned food items with pop-top lids, baby diapers for all ages and baby wipes, personal care items such as shampoo, deodorant, and feminine care products. You can learn more about how to donate these items by visiting handsonasheville.org and click on the COVID-19 page. Once you're there, select the InKind Donations button, where you will be prompted to fill out a short form. Once the form is completed, United Way of Asheville and Buncombe County will match your donation to a community organization currently dispensing these critical supplies throughout our community. We will provide the next community update on Monday, April 13th at 2:30 p.m. After this community update, we encourage you to tune in to a very rich and informative conversation called Bridging Culture and Health in the Midst of COVID-19. This is aired live today at 4 p.m. on WRES LP FM 100.7. Please continue to use the CDC website, the State of North Carolina's COVID-19 page, and Buncombe County Government's page for accurate information on COVID-19. Thank you for doing your part to stay informed.